Hormonal balance is the foundation of female health, influencing everything from menstrual cycles and ovulation to fertility, mood, and long-term disease risk. The primary hormones involved, estrogen, progesterone, and androgens, operate in a delicate feedback loop controlled by the hypothalamus and pituitary gland in the brain. The hypothalamus releases gonadotropin-releasing hormone in a pulsatile pattern, which signals the pituitary to secrete luteinizing hormone and follicle-stimulating hormone. These in turn act on the ovaries to regulate egg development, ovulation, and the production of estrogen and progesterone. When this system functions properly, menstrual cycles are regular, ovulation occurs predictably, and the uterine lining prepares and sheds efficiently. However, even minor disruptions in this feedback loop can lead to irregular cycles, anovulation, and other reproductive issues. Estrogen is not a single hormone, but a family of compounds, with estradiol being the most potent during reproductive years. Estrogen regulates the growth and maintenance of the uterine lining, supports bone density, modulates lipid metabolism, and affects the cardiovascular system. Progesterone plays an equally crucial role, especially after ovulation, by stabilizing the uterine lining and supporting early pregnancy. It also has calming effects on the nervous system and contributes to healthy sleep patterns. Androgens, often labeled as male hormones, are present in females in smaller amounts, but are essential for libido, energy levels, and the regulation of ovarian function. An imbalance among these hormones, whether through excess estrogen, insufficient progesterone, or elevated androgens, can manifest as heavy or irregular bleeding, mood swings, acne, or hair growth patterns, signaling deeper disruptions in endocrine function. External factors heavily influence this internal hormonal network. Nutritional deficiencies, high sugar intake, chronic stress, and poor sleep can alter the hypothalamic pituitary ovarian axis, either by directly affecting hormone secretion or by increasing insulin and cortisol levels, which indirectly interfere with ovarian function. Environmental toxins, such as endocrine-disrupting chemicals found in plastics and certain personal care products, mimic or block natural hormones, further destabilizing the balance. Even moderate changes in body composition can shift hormone levels. Excessive body fat can elevate estrogen due to peripheral conversion of androgens, while too little fat can suppress reproductive hormone production, leading to cycle irregularities or amenorrhea. Monitoring and supporting hormonal balance requires attention to both biological markers and lifestyle habits. Blood tests and cycle tracking can reveal patterns in estrogen, progesterone, and androgen levels, providing insight into potential imbalances. Complementary strategies, such as maintaining a nutrient-dense diet rich in fiber and phytoestrogens, regular physical activity to optimize insulin sensitivity, stress management techniques like meditation or breath work, and consistent sleep schedules, can stabilize hormone production and feedback loops. Regular check-ins with a healthcare professional familiar with endocrine function are critical, especially for individuals experiencing irregular cycles, unexplained weight changes, or mood disturbances, as these may indicate underlying hormonal dysregulation. Maintaining hormonal balance is not about eliminating natural fluctuations, but about ensuring the body can regulate these fluctuations efficiently. Small, consistent lifestyle interventions can enhance resilience in the hormonal system, improving menstrual regularity, fertility outcomes, metabolic health, and overall well-being. Approaching female hormone health through a systems-level perspective allows for interventions that address both the root causes and the downstream effects of imbalances, creating a foundation for long-term reproductive and systemic health. Polycystic ovary syndrome, or PCOS, is one of the most common endocrine disorders in women of reproductive age, affecting hormone balance, metabolic health, and fertility. At its core, PCOS is characterized by elevated androgen levels, irregular menstrual cycles, and often insulin resistance. These features are interconnected, creating a cycle that can be difficult to break without targeted interventions. Insulin resistance plays a central role, as higher insulin levels stimulate the ovaries to produce more androgens, including testosterone. This excess androgen disrupts normal follicle development, often preventing ovulation and leading to the characteristic irregular or absent menstrual cycles seen in PCOS. Beyond reproductive implications, elevated androgens and insulin resistance contribute to other systemic issues, including increased risk for type 2 diabetes, cardiovascular disease, and non-alcoholic fatty liver disease. The symptoms of PCOS can vary widely, but commonly include irregular periods, acne, hirsutism or excessive hair growth, thinning scalp hair, and weight gain, particularly around the abdomen. These physical manifestations are direct consequences of hormonal imbalances, reflecting the overproduction of androgens and the body's impaired response to insulin. Women with PCOS often experience challenges with fertility due to anovulation, but it is important to recognize that fertility can often be restored with interventions that correct hormonal signaling and improve metabolic function. Early diagnosis and management are critical, not only for reproductive health, but also to reduce long-term metabolic and cardiovascular risks. Addressing PCOS effectively requires a multifaceted approach that targets both hormonal imbalance and metabolic dysfunction. Lifestyle interventions are foundational as diet, exercise, and weight management directly influence insulin sensitivity. A diet with low glycemic index foods, adequate protein, healthy fats, and fiber can help stabilize blood sugar and reduce insulin spikes, which in turn can lower androgen production by the ovaries. Regular physical activity enhances glucose uptake by muscles independently of insulin, improving metabolic flexibility and supporting hormonal balance. Even moderate weight loss can dramatically improve ovulatory function and decrease androgen levels, highlighting the strong connection between metabolism and reproductive health. Pharmacological support can complement lifestyle interventions when necessary. Medications like insulin sensitizers help lower circulating insulin levels, reducing ovarian androgen production, while hormonal contraceptives can regulate menstrual cycles and reduce androgenic symptoms. In some cases, fertility-specific treatments, including ovulation induction medications, are required to assist conception. Beyond medications, managing chronic stress and improving sleep quality are often overlooked, but essential components as cortisol and disrupted circadian rhythms can exacerbate both insulin resistance and androgen imbalance. PCOS is not merely a reproductive disorder. It is a systemic condition that requires attention to metabolic, hormonal, and lifestyle factors simultaneously. Education and self-awareness empower individuals to make sustainable changes, and regular monitoring of hormone levels, blood sugar, and metabolic markers allows for early intervention and better long-term outcomes. Understanding the underlying mechanisms of PCOS highlights the importance of integrating lifestyle, medical, and behavioral strategies to restore balance, improve fertility, and reduce risks for associated metabolic conditions. Endometriosis is a complex and often debilitating condition in which tissue similar to the lining of the uterus grows outside the uterine cavity, most commonly on the ovaries, fallopian tubes, and pelvic lining. This ectopic tissue responds to hormonal signals, particularly estrogen, in the same way that the uterine lining does during the menstrual cycle. Each month, it thickens, breaks down, and bleeds, but unlike normal uterine tissue, it has no efficient exit pathway. This leads to inflammation, scar tissue formation, and adhesions, which can cause chronic pelvic pain, painful periods, and pain during intercourse. Over time, these inflammatory processes can distort pelvic anatomy, complicating fertility and impairing ovulatory function. The severity of symptoms does not always correlate with the extent of tissue growth, meaning some individuals with extensive lesions may experience minimal discomfort, while others with relatively small lesions suffer significant pain. The hormonal environment plays a critical role in the progression of endometriosis. Estrogen promotes the growth and maintenance of endometrial-like tissue, while progesterone normally counterbalances estrogen's effects by inducing tissue stabilization and limiting proliferation. In many individuals with endometriosis, there is evidence of progesterone resistance, meaning that the tissue fails to respond effectively to progesterone signals. This imbalance favors continued growth and inflammation of ectopic tissue. In addition to local hormonal effects, immune system dysfunction appears to contribute, as aberrant immune responses fail to clear misplaced tissue and may perpetuate inflammation. Chronic inflammation in endometriosis is characterized by elevated levels of cytokines, prostaglandins, and other inflammatory mediators that contribute to pain, tissue remodeling, and impairment of normal ovarian function. Fertility challenges in endometriosis stem from multiple mechanisms. The inflammatory environment can damage eggs, interfere with fertilization, and impair embryo implantation. Scar tissue and adhesions can physically obstruct the fallopian tubes or alter the position of reproductive organs, further reducing the likelihood of natural conception. While surgery can remove lesions and restore anatomy, hormonal treatments are often necessary to suppress further tissue growth and manage symptoms. Therapies may include oral contraceptives, progestin-only treatments, gonadotropin-releasing hormone agonists or antagonists, all of which aim to reduce estrogen stimulation and minimize cyclical bleeding of ectopic tissue. Beyond pharmacologic and surgical interventions, lifestyle strategies can modulate the inflammatory and hormonal environment. Diets rich in anti-inflammatory foods, including omega-3 fatty acids, fiber, and antioxidants, can reduce systemic inflammation and may improve symptom management. Regular physical activity improves circulation and helps reduce estrogen dominance by influencing body fat distribution and metabolic regulation. Stress management techniques such as meditation, yoga, and controlled breathing exercises are important because chronic stress can elevate cortisol, which interacts with sex hormone pathways and can exacerbate inflammatory responses. Understanding endometriosis requires a systems-level perspective, recognizing that it is not solely a reproductive condition, but an interplay of hormonal dysregulation, immune dysfunction, inflammation, and environmental factors. Early diagnosis, individualized treatment, and integrative strategies targeting hormones, inflammation, and lifestyle factors can improve pain management, preserve fertility, and enhance overall quality of life. Fertility is highly dependent on the precise coordination of hormones within the hypothalamic pituitary ovarian axis, which regulates the growth and release of eggs and prepares the uterus for potential implantation. The hypothalamus releases gonadotropin-releasing hormone in a pulsatile pattern, signaling the pituitary gland to secrete luteinizing hormone and follicle-stimulating hormone. These hormones act on the ovaries to stimulate follicle development, trigger ovulation, and support the production of estrogen and progesterone. Any disruption in this signaling, whether from metabolic, environmental, or lifestyle factors, can interfere with ovulation and reduce reproductive potential. Stress, inadequate sleep, poor nutrition, and metabolic imbalances can all alter hormone pulsatility and disrupt the delicate timing necessary for successful conception. Even small changes in hormonal patterns can delay ovulation, reduce egg quality, and impair endometrial receptivity, highlighting the sensitivity of the reproductive system to internal and external influences. Stress is one of the most significant disruptors of fertility. Elevated cortisol levels associated with chronic stress can suppress hypothalamic release of gonadotropin-releasing hormone, leading to irregular or absent ovulation. Stress also influences insulin and androgen levels, both of which can further disrupt ovulatory function. Addressing stress through practices like mindfulness, controlled breathing, meditation, or gentle physical activity can help restore hormonal balance and support ovulation. Sleep is equally critical, as the reproductive system relies on circadian rhythms to regulate hormone secretion. Disrupted sleep patterns can lead to altered levels of luteinizing hormone, follicle-stimulating hormone, and melatonin, all of which play roles in follicular development and ovulatory timing. Prioritizing consistent sleep schedules and optimizing sleep quality enhances hormonal synchronization and improves fertility potential. Metabolic health is another key factor in fertility. Insulin resistance, obesity, and nutrient deficiencies can impair ovarian function and egg quality. High insulin levels can increase androgen production in the ovaries, leading to irregular ovulation or anovulation, as observed in conditions like polycystic ovary syndrome. Maintaining stable blood sugar through a balanced diet rich in fiber, lean protein, and healthy fats, combined with regular physical activity, can improve insulin sensitivity and support reproductive hormone balance. Adequate intake of essential nutrients such as folate, vitamin D, omega-3 fatty acids, and antioxidants also contributes to egg quality and overall reproductive health. Environmental and lifestyle factors further influence fertility. Exposure to endocrine-disrupting chemicals, excessive alcohol, smoking, and certain medications can interfere with hormone signaling and ovarian function. Minimizing exposure to these disruptors and adopting supportive lifestyle practices can significantly improve reproductive outcomes. Tracking menstrual cycles and hormonal patterns provides insight into ovulatory timing and helps identify potential disruptions early, allowing for targeted interventions. Optimizing fertility requires a systems-level approach that considers the interaction between hormones, metabolism, lifestyle, and environment. Supporting the body's natural rhythms, reducing stress, improving sleep, and maintaining metabolic health are all critical to ensuring consistent ovulation, high-quality eggs, and a receptive uterine environment. Understanding these mechanisms empowers individuals to make informed choices that enhance fertility. Improve breast health is intricately linked to hormonal regulation, particularly the balance between estrogen and progesterone. Estrogen stimulates the growth and proliferation of breast tissue, while progesterone provides regulatory effects that stabilize tissue and counteract excessive proliferation. Persistent exposure to elevated levels of estrogen, especially without adequate progesterone opposition, can increase cellular replication in breast tissue, which over time may contribute to the development of hormone-sensitive breast cancers. Factors that influence estrogen exposure include reproductive history, body composition, diet, environmental exposures, and lifestyle habits. For example, early menarche, late menopause, and pregnancies, later in life or absence of full-term pregnancies, can increase lifetime estrogen exposure, which correlates with higher breast cancer risk. Body composition and metabolic health play a critical role in modulating circulating hormone levels. Adipose tissue is hormonally active and can convert androgens into estrogen, particularly estrone, increasing systemic estrogen levels. This is especially relevant in individuals with higher body fat percentages, as prolonged elevation of estrogen without the counterbalance of progesterone can create an environment conducive to abnormal breast tissue proliferation. Conversely, very low body fat levels can disrupt hormonal cycles and indirectly affect breast tissue maintenance. Maintaining a healthy body composition through balanced nutrition and regular exercise can help optimize hormone levels and support breast tissue health. Diet and lifestyle factors also directly influence hormone balance and breast cancer risk. Diets high in processed foods, refined sugars, and trans fats can exacerbate inflammation, insulin resistance, and hormonal dysregulation, while nutrient-rich diets that include fiber, phytoestrogens, antioxidants, and healthy fats support hormonal metabolism and cellular health. Alcohol intake is another important consideration, as it can increase estrogen levels and reduce the body's ability to metabolize carcinogens, further raising the risk of breast tissue proliferation. Regular physical activity not only improves insulin sensitivity, but also reduces circulating estrogen levels and promotes overall metabolic health, creating a protective effect for breast tissue. Environmental exposures can impact breast health through endocrine disruption. Chemicals found in plastics, pesticides, and personal care products can mimic or interfere with natural hormones, altering estrogen and progesterone signaling in breast tissue. Reducing exposure to these chemicals and prioritizing natural or non-toxic alternatives can help maintain hormonal balance and support healthy tissue regulation. Additionally, chronic stress affects the hypothalamic pituitary adrenal axis, increasing cortisol and potentially influencing estrogen metabolism, which underscores the importance of stress management practices in preserving breast health. Monitoring reproductive and hormonal milestones can provide indirect insight into breast tissue exposure to estrogen. Age at menarche, menstrual cycle regularity, pregnancies, and menopause onset all serve as markers of cumulative hormone exposure. Regular checkups and screenings, combined with a proactive approach to lifestyle, nutrition, and environmental awareness, help mitigate risk and promote long-term breast tissue health. Understanding the interplay of hormones, metabolism, and environmental factors allows for strategies that reduce cancer risk while supporting overall reproductive and systemic well-being, reproductive outcomes, and support long-term reproductive health. Lifestyle is one of the most powerful modulators of female hormone health, influencing reproductive function, metabolic balance, and long-term disease risk. Nutrition, exercise, sleep, stress management, and circadian rhythm alignment all interact with the hypothalamic pituitary ovarian axis and peripheral hormone signaling to maintain balance and resilience within the endocrine system. Nutritional intake affects hormone synthesis and metabolism directly. For instance, diets high in refined carbohydrates and sugars can exacerbate insulin resistance, which in turn drives androgen overproduction in conditions like polycystic ovary syndrome. Conversely, diets rich in fiber, lean proteins, healthy fats, and phytonutrients help regulate blood sugar, support liver function for hormone detoxification, and provide micronutrients necessary for estrogen and progesterone metabolism. Adequate intake of vitamins such as B6D and minerals like magnesium and zinc is essential for optimal enzyme activity and steroid hormone pathways. Exercise serves multiple functions in hormonal health beyond weight management. Regular physical activity improves insulin sensitivity, reducing compensatory hyperinsulinemia and subsequent androgen excess. Strength training and moderate aerobic exercise also influence body composition, which impacts estrogen levels, particularly through adipose tissue conversion of androgens to estrogens. Physical activity additionally promotes healthy circulation, reduces systemic inflammation, and positively affects mood and stress resilience, all of which feed back into hormonal regulation. Importantly, exercise must be balanced. Excessive training without sufficient caloric intake or recovery can disrupt the hypothalamic pituitary ovarian axis, suppress ovulation, and reduce fertility, highlighting the importance of a sustainable and individualized approach. Sleep and circadian rhythm alignment are equally critical for hormone regulation. The hypothalamus coordinates reproductive hormone pulsatility in concert with circadian signals, and disrupted sleep can impair the release of gonadotropin-releasing hormone, luteinizing hormone, and follicle-stimulating hormone. Poor sleep quality or irregular schedules elevate cortisol and alter melatonin production, both of which can interfere with estrogen and progesterone balance, ovulatory function, and even breast tissue health. Prioritizing consistent sleep schedules, minimizing light exposure at night, and ensuring adequate restorative sleep enhances hormonal synchronization and supports reproductive and systemic health. Stress management is another vital component of lifestyle modulation. Chronic stress elevates cortisol, which interacts with insulin and reproductive hormones, potentially suppressing ovulation, increasing androgen levels, and promoting inflammatory pathways that negatively impact conditions like endometriosis or fertility. Techniques such as mindfulness meditation, controlled breathing, yoga, and other forms of relaxation can lower cortisol, improve autonomic balance, and indirectly support hormone homeostasis. Environmental and behavioral factors also play a role. Reducing exposure to endocrine-disrupting chemicals found in plastics, pesticides, and personal care products limits external interference with estrogen and progesterone signaling. Regular health monitoring, including hormonal assessments and reproductive checkups, allows for early detection of imbalances and facilitates timely interventions. By integrating nutrition, exercise, sleep, stress management, and environmental awareness, individuals can strengthen the body's ability to regulate hormones, improve fertility outcomes, reduce the risk of hormone-sensitive conditions, and promote long-term systemic health. By consistently applying these lifestyle strategies, the body's hormonal system becomes more resilient and better able to maintain balance despite internal and external stressors. Over time, these habits not only improve reproductive health and fertility, but also reduce the risk of hormone-related conditions such as PCOS, endometriosis, and breast cancer. Small, deliberate choices in daily routines, nutrient-rich nutrition, regular physical activity, restorative sleep, effective stress management, and minimizing environmental exposures accumulate to create a stable hormonal environment. This holistic approach empowers individuals to take control of their hormone health, supporting overall well-being, long-term vitality, and the body's natural capacity to function optimally.